Hi, welcome to the Fit and Healthy Today show. Today, the subject matter we're going to address is ear infections. Usually when I pick a topic, I kind of mull it around and see what my customers have been coming in complaining about, what the physicians are telling me their patients are complaining about. And this last week, it tended to be a lot about ear infections. We've had a lot of temperature changes, and as winter temperatures drop, we tend to see an increase in ear infections and colds and upper respiratory infections. So when we talk about ear infections, there's two different kinds. There's an external ear infection, which we see a lot with swimmer's ear. You know, when you get moisture in there, it'll trap bacteria, viruses, fungals, and then you end up with an outer ear infection. The next type of infection is what we call middle ear infections, and those are very, very common in infants and children. As a matter of fact, they estimate between 50% to 2/3 of children will suffer an ear infection before they get into kindergarten. So very, very common. In children, the reason why these infections are more common is because the eustachian tubes, this tube is connected to the eardrum, and it drains out fluids out of the eardrum. Well, in children, oftentimes it's in a horizontal position, so it doesn't allow for the drainage, and so you'll get viruses and bacteria trapped in there, and boom, they end up with the ear infection, the middle ear infections. They're generally, most of the time, viral caused, and oftentimes start with like a sinus infection, upper respiratory infection, or a cold, because that drainage is just not occurring through all this upper part of the body. The causes, when we talk about causes, there are many of them, depending on what type of infection you address. We tend to see a lot with people who have a lot of heavy wax buildup, and that doesn't mean you stick the Q-tip in there, because actually that can push that in there. But there's other ways that I'll talk about that we can get that wax buildup out of there, particularly in kids and in adults as well. Upper respiratory infections, colds, sinus infections, because of that drainage, it just we'll get that not properly drained, and we'll get an infection in that eardrum area. Seasonal, the winter time, as I discussed, the physicians and my customers are coming in saying, uh-oh, you know, the weather's getting cooler, and all of a sudden we're seeing a little bit more wind and the cold wind, and boy, there goes the infections. Fetal alcohol syndrome. 90% of kids who had fetal alcohol syndrome have numerous, usually more than 2 infections before kindergarten. So really raises the risk factor. Genetics. Obviously, if you have genetics such where the eustachian tubes are horizontal, and that's a genetic issue, and you don't get good drainage out of that eardrum, or eardrums, then you're going to end up with an increased risk of ear infections. Nutritional deficiencies, particularly of vitamin C, vitamin A, and essential fatty acids, all of which help these membranes work better, help fight off infection, and keep things a little bit more movement in the fluids. Essential fatty acids loosen things up, loosen mucus, keep things flowing a little bit better. Neck and head injuries at birth, and then also, you know, the way kids are rough and tumble, they fall and hit themselves. We'll see that sometimes that shifting here, or breaking of the nose, or the squeezing of the head area. For some reason, those trauma types of injuries increase the risk of ear infections as well. And actually, there's been studies that have supported that some good old chiropractic, getting things back in balance and straightened in the neck area and the facial, can help with those types of caused ear infections. Sanitation. We don't want things to be sterile, but we do want them to be clean. And so if kids are sitting there putting dirt in their ears, obviously they're going to do it, the risk factor increases, or such if you're using a Q-tip and you're shoving that bacteria back in there. Q-tips were meant for the outer portion of the ear, not for the inner portion of the ear. There are solutions that you can get, or simple olive oils that can loosen up the wax. My mother used to lay us down and use a little bit of hydrogen peroxide to loosen it up, and then the wax, she put a little olive oil in there, and then the wax would fall out. So that's a way to help with some of that wax buildup. There's also something called ear candling. ear candles, and it sounds like something kind of strange, but what they are, and the American Indians use it, and they use it a lot in Europe. They're little candles. I wish I would have brought some to show you, that basically you put in the ear, you light in a very slow burning flame, and they're thinking, I'm going to catch on fire, but you're not. It burns very slowly, and it forms a vacuum inside this ear candle, and it'll pull out that wax without causing any harm to the ear. I know my mother does it on my father continually because he has hearing issues, and it does help. That wax buildup, once again, contributing to infections, as well as can be for hearing loss as well, too. Symptoms that we see tend to be fever, nausea, vomiting. Pus from the ear is when it's probably pretty extreme, and hearing difficulty. Particularly if you're getting fluid and the eardrum swells, you're going to have a problem hearing, sometimes for 2 to 4 weeks. So your infection can be gone, but yet you'll still have that fluid in there. So keeping that in mind, it takes time sometimes for ear infections to go away. I'd like to discuss with you some diet issues as far as contributing factors or things to avoid if you tend to be more prone to ear infections, or that will increase the risk of ear infections. Particularly in kids. We see a lot of food allergies with kids, milk allergies in particular, but the things that tend to be the most common allergens that will contribute to that mucousy, fluidy, stuffy kind of thing would be foods such as dairy, wheat, sugar, citrus fruits, soy, eggs, or chocolate. You can have blood work done that will test you whether or not you are allergic to these items and how allergic, whether you should completely avoid them. I went into an Oriental medicine doctor over in Solvang by the name of Linda Crone. She pulled some blood for me, or actually sent me over to San Ynez lab, pulled blood for me, they sent it off, and I got a test back of the 99 most common foods I was allergic to. It was a report. And I found out I was off the scale for eggs, off the scale for milk. So things that I kind of maybe might have known, but I may include in my diet, were causing me a lot of allergies and actually gave me an ear infection about 8 years ago. One of the most painful things I've had in a very long time as an adult, with the contributing factors being these allergens. So avoiding these either through food elimination or getting the blood work done can be very, very helpful. Eating whole grains, quality protein, fresh fruits and vegetables, avoiding sugar. Remember, 1 teaspoon suppresses the immune system for 4 to 6 hours. So if you eat a lot of sugar and processed foods, your immune system is going to drop, your body's ability to fight off infection. If you don't have a balanced diet with these good foods, you're going to end up with nutritional deficiencies. So diet is probably one of the best ways you can prevent ear infections. When we're talking about supplements that are available, if you get an ear infection, now since 3/4 of the ear infections are generally viral caused, we kind of want to look to things that are going to tend to kill viruses. Antibiotics only kill bacterial infections. They do not help viral infections. As a matter of fact, they can help viral infections get worse. And we'll talk about some studies that address the usage of antibiotics with ear infections. Garlic oil. We have these little, tinctures at my store, or actually at all 4 of our stores that my husband and I have, that are garlic based, that actually have a little bit of white willow bark. And what you do is you put it in the ear when you suspect an infection, and it kills viral, fungal, and bacterial infections. It works a couple times a day, and it'll kill it, whether it's, like I said, viral, bacterial, or fungal based. Homeopathic earache formulas. There was a really good study done by the, where it is on here, there we go, Dr. Frieses. It's a biomedical clinic that tends to work with children. And what they did is they took some children that were treated with homeopathic earache formulas, and there's various companies that manufacture them, and they compared them with children who were treated with antibiotics, conventional treatment. They found out that the reoccurrence rate of kids who had been on antibiotics was a minimum of 16% higher than the children who had used the homeopathic remedies. Most physicians and most medical journals really push that physicians really need to take in consideration not to be pushing antibiotics on kids for ear infections. Colloidal silver. Colloidal silver is also an antimicrobial, kills viral, fungal, and bacterial infections. You can use that in the ear, and you can take that internally in order to help fight off infection that you might be the upper respiratory or sinus infections, or you can put it directly in the ear and to help ward off and kill off infection, particularly if you know your child tends to be prone to that. I usually tell parents when their kids tend to be more prone to ear infections that an ounce of prevention is worth a pound of cure. And if after their bath they put in a drop of the garlic oil in the ear for prevention, and the garlic oil is mixed usually with a little bit of olive oil, you can prevent some of these ear infections. There are other formulas that contain tea tree and grapefruit seed extract that also kill infection, that are very effective, once again, against microbials, viral, fungal, and bacterial infections. Ester C. Whenever, that's a mineral ascorbate C, that's vitamin C as we find it in nature. Vitamin C in nature is not ascorbic acid. It is always bound to a mineral such as calcium and magnesium. These types of vitamin C's help bolster the immune system, but they also help the canals and the eardrum function and heal a little bit quicker as well. A good multivitamin mineral. I think it's paramount nowadays with the way our farming is done. The farming practices we have now, the soil is pretty stripped. So we've got food, it kind of has a taste, but it's pretty nutrient deficient. So since we know that most of the country, and even the American Medical Association said everybody should be taking a multivitamin, we just aren't getting it from our food. We wouldn't be having this conversation 75 years ago. We are now because our foods just don't have the same nutritional value in them. Essential fatty acids, be it in nuts, fish oil, flax oil, any of those kinds of good fats reduce inflammation and keep secretions going better in the body. Vitamin A. Vitamin A and vitamin D, we have found, really help you fight infection. And so what that means, since most of our children are vitamin A and vitamin D deficient, up goes the infection rate. So if your child is not taking a multi, which they should be, you can add in additional amounts of vitamin A. Now vitamin D, I've not seen any kids good multi that contain high enough levels of vitamin D. For kids, a minimum 1,000 IUs with all the studies. I know Ralph, our research analyst, has been discussing the needs of vitamin D, particularly in children, for so many different issues. And we know as far as with ear infections as well, it's very, very important. Garlic. You can take, my 10-year-old, he's amazing. We have this liquid garlic. It's a deodorized liquid garlic. And whenever he feels something coming on, he pours himself a little bit. Actually, he has his own bottle, and he kind of does the milk thing and squirts it directly in his mouth. But garlic, or liquid garlic, raw garlic, whatever you can do. Garlic, once again, is an antimicrobial, and it kills viral, fungal, and bacterial infections. Internally taken or topically applied. Whenever you are on an antibiotic, and we have a very good pediatrician in town by the name of Dr. Blyfeld, she puts the kids on antibiotics, she puts them or recommends they take a probiotic. We think what's occurring with these kids that have chronic ear infections is it destroys lots of their good bacteria, and then the reoccurrence rate of ear infections and other infection occurs. So by giving them the probiotic, which means pro-life, it can help lessen those reoccurrences and put back in that good bacteria. GSC nasal spray, grapefruit seed nasal spray. If your child has chronic issues with sinuses, which can be yeast, viral, bacterial infections, the grapefruit seed nasal spray, especially if you've seen the little greenies coming from the nose, they drain out, use this grapefruit seed nasal spray to kill off this this upper respiratory infection in the sinuses, to hopefully keep it from going right into the ears. Simple, easy way to keep the ear infection levels down and to get rid of sinus infections, which feed ear infections. I mentioned chiropractic before because sometimes trauma injuries or structural injuries or structural form can contribute to ear infections. If a child gets, or an adult, like in my case 8 years ago, gets a infection, massaging, and there's 3 key areas they recommend: down by the mastoid, down right in here by the ear. Okay, you're going to massage all down in this area, and then believe it or not, the temples. That seriously can reduce, they estimated in some of the studies, between 30 and 40% of pain, just that massage area. And then if you apply a little bit of warmth to the area, and you know, these have these things you can microwave, you can put the warmth or a warm towel or whatever to try and bring some relief. Although I have to tell you, if you use the garlic with white willow, you'll kill off the pain. And then the homeopathics under the tongue remedies help take the edge off of those ear infections, especially in kids. There are some studies, one of which I already mentioned by the Biomed. The British Medical Journal, several studies found there was no difference in children on a placebo or antibiotics as far as recovering from ear infection. Well, what that means when they say placebo is mean there was no difference in recovery between the children who were on nothing versus children who are on antibiotics. And when these numerous studies came out, most physicians were told, hey, back off those antibiotics because, you know what, the studies aren't supporting they're doing our kids much good. U.S. Agency for Healthcare Policy and Research, once again, they supported 90% of cases resolved untreated. So, once again, you can fight it off with some natural remedies or let it go its course. Obviously, it's more painful to let it go its course. And some natural remedies can help fight it off much quicker. A lot of kids that have chronic ear infections will see some of this tubing done. They'll put tubes in there that help the ears drain. And what the Journal of American Medical Association found that only about 42% of the ones that were put in, 42% of these ear tube surgeries were appropriate. So what that translates into is 58% of them were inappropriate. So before you consider ear tubes, which actually can lend itself to some hearing loss as well, consider doing some natural preventative types of things like we discussed, examining the allergies that are contributing factors, prevention with garlic oil and other things, colloidal silver, whatever you can do to prevent those ear infections from forming, because chronic ear infections can form scar tissue and lessen the hearing. Now, I want to tell you about an incident that happened to me when my 17-year-old, when he was 2, he was put on antibiotics and the ear infection wasn't going away. So the pediatrician put him on another antibiotic. Well, I couldn't figure out what was going on 2 weeks later because my son, he couldn't have a bowel movement. And it was getting critical, he was getting a fever. I took him to the pediatrician and thank God the pediatrician diagnosed him not with flu. We went over to Good Samaritan Hospital and found out my son's intestines had completely twisted around because the good bacteria had been completely destroyed by the antibiotics. So they had to cut my son open and do emergency surgery and untie his intestines. He almost died. So I'm not a big proponent. If they got an ear infection and you got alternatives, you find those alternatives. Take it from a mother who almost lost her son because of antibiotics. That's what got me into all of this because I vowed I would never have him on antibiotics again. So there's a time and place for antibiotics, but in situations with ear infections, look for alternatives based upon what the American Medical Association is telling us, the British Medical Association is telling us, and do your best in that regard. And then, of course, as always, conduct your own research regarding this. Next, we're going to be moving on to the fitness portion of our show. I hope this has been informative for you. Welcome to the fitness portion of our show, and today we're going to be working on exercises for the hands. Such magnificent creations by God. Everything just about we do in life are with our is and are with our hands. And so I'd like to show you some exercises, particularly for those who tend to suffer from stiff hands, rheumatoid arthritis, or osteoarthritis conditions that I'm hoping will help strengthen your hands a little bit and give you a little bit more flexibility and movement. Very simple. This is an old 40-some-year-old exercise that Jack LaLanne used on his show years and years ago, and I want to share it with you here probably about the same time as I was born. This exercise came out. So anyway, what you do is you put your hands in front of you, and you can do this first thing in the morning when you get out of bed, and what you do is you're just going to squeeze like this, nice, slow, steady rate, for about 15 repetitions. Okay, and then you turn it over for about 15 repetitions. And then you turn over the pancake again, 15 repetitions. So what we're doing is we're going from here to here to here, or from here to here to here. Just a slight change, because it changes the angles of how it works around the wrist. And then after you do that for 15 reps on each part, then we try to go a little faster. We try to get the movements going in our fingers as fast as you can, and close it as much as you can, because what happens then is you'll get more flexibility with time. It's going to work those muscles. But if you notice too, as I'm squeezing here, it hits some wrist muscles. It hits some other muscles. So we're trying to work on just getting circulation into the hands and getting the muscles built and utilize muscles, tendons, and ligaments utilized in the hands. I hope that exercise helped. If you can do a little bit of that every day as part of your wake-up routine, I think you'll see more ability to move the hands in a better fashion with less pain. Next, we're going to be moving on to our research portion of our show. Hi, welcome back to the Fit and Healthy Today show, and with us today is our research analyst, Ralph Turchiano.
Thank you for the intro. Well, there's a sports supplement out there that seems to be very beneficial for seniors. In fact, so beneficial, after 90 days, it increased your fitness levels by 67%. And this supplement is called beta-alanine, very common in sports nutrition right now for helping the muscles to heal. And this article was printed out of the Journal of International Society of Sports Nutrition, so it's pretty credible. Now, combine this with creatine will probably have some pretty good effect for the seniors, but 67% after 3 months is pretty darn neat. And again, now is beta-alanine. After that, let's go to the other end of the spectrum. Let's go to the kids. Got a little issue here with kids who are considered obese. Recently did a survey, and this was in the American Heart Association Scientific Sessions of 2008 survey, where they looked at obese children and their arteries. What they discovered was that these children, that were 13 years old, had the arteries of those which are 45. There's a little good news to this, though. The plaque that was formed on their arteries, although bad at such an early age, was not hardened. So it may be, they believe may be reversible. The best option is to make sure they don't get in that position to begin with. Because as time goes on, as according to the next article, there may not be many people to help them. Why? Because at a survey, it's called the Physicians Foundation, and they said, quote, primary care doctors in the United States feel overworked, and nearly half plan to either cut back on how many patients they see or quit medicine entirely. They also said, quote, and 60% of 12,000 general practice physicians found they would not recommend medicine as a career. They also said, too, they found 78% of those answered the survey, at 12,000, keep that in mind, said there was an incredible shortage of primary doctors. Real important, people. You got to take care of your health. You can't expect your physician to do it all for you. You got to meet them at least halfway. A lot of these doctors are getting heavily discouraged because they're doing what they can for the patient, but the patient itself has to do something for themselves also. Disturbing. This continues. There may not be many people around to help other people. Number 4 in our articles, plastic surgeons warn of malnutrition, especially when it comes to body contouring. They took a look. This was in the December issue of Plastic and Reconstructive Surgery. They took a look at medical literature from the 1940s when this first started to begin. And they looked at what happened between people who took supplements and did not take supplements. These supplements, of course, were your B vitamins, your glutamine, your amino acids, and all the way down the line. This is what happened. They compared the healing of 75 massive weight individuals who went through body contouring from 2001 to 2005. Basically, 66% of those people suffered from complications. Compared to the group of individuals who took supplements and took care of themselves prior to the surgery, only 19% of those people had complications. 66% to 19%, Pretty darn important. They also said, too, it improved the healing process, wound tension, scar quality, in addition to increasing the patient's energy levels. There were 67,000 of these surgeries last year, so something to think about. Now we go to IBS. They compared a few different things for people with irritable bowel syndrome. They compared antispasmodics, fiber, and peppermint oil. And they looked at 2,500 adult patients with irritable bowel syndrome. This came out of the National Institute of Health and Clinical Excellence. What they discovered out of the antispasmodics, fiber, and peppermint oil was the best. It beat all traditional treatments basically hand down. Now, all of them worked a little bit, but peppermint oil by far did the best job out of all of them. And then we go to kind of our black eye segment. This has to do with a drug that resulted in people literally having to have their bowels surgically removed. Roche Laboratories lost a lawsuit on this drug, which resulted in a $13 million fine for the company in regards to 3 individuals. What was this drug that they said is associated with what they now believe irritable bowel disease? Accutane. They discovered, and this is what the jury awarded these people for, that Accutane is somehow becoming directly related to irritable bowel disease itself. The lawyers representing the 3 patients presented internal Roche studies that they argue showed the company knew Accutane caused damage to the intestinal tract that led to inflammatory bowel disease itself. The company still denies it today. They are still not recommending it to basically their doctors. There's a little bit of warning in there, but that's as far as it goes. So when there's something to think about, you have to remember there's been 13 million of these prescriptions of Accutane in the United States since 1982. So basically, if you care about your kids, you care about yourself, either in the age between 15 to 35, you start taking Accutane, your digestion starts getting messed up a little bit, it's something really to start to look at and consider. Very dangerous, and possibly something that may be looking at a black label warning potentially. Well, that's it for the end of our research segment, and thank you very much.
Thank you very much, Ralph. I hope that this encourages you to further research and discover for yourself alternatives and actually take your health once again into your own hands, doing the very best that you possibly can to find the answers. Looking to others, your doctors or others for answers isn't always the way. Sometimes you got to rely on yourself. Look at the research that's out there like that Ralph presented. Listen to various people. Read. Take your health, your diet, and your nutrition into your own hands. Thank you again for joining the Fit and Healthy Today show, and we'll see you next time.